سيدنا محمد وعلى آله وصحبه وبعد. This is Professor Dr. Tarek Ali. Today I will talk about an important clinical issue or clinical topic, which is diseases associated with muscle symptoms, or diseases associated with myopathy, or diseases associated with myositis. That is, myopathy means that there is a pathologic condition in a muscle which might present with symptoms related to the muscular tissue as human tissue. And the diseases which present with muscle symptoms, they are multiple. And they can be classified into two main categories, either genetic, that is hereditary diseases associated with muscle symptoms, and number two, acquired causes or acquired diseases presenting with myopathies or with symptoms related to muscles. Let me first talk about symptoms related to diseases or pathology in a muscle. Clinical symptoms and signs are namely muscle weakness, whether it is proximal muscle weakness or distal muscle weakness or diffuse muscle weakness. That is muscle weakness. This is number one a common clinical symptom related to a disease of a muscle. That's muscle weakness. And then we have the muscle atrophy or wasting of the muscles. And by the muscles here, I mean the skeletal muscles, the voluntary muscles. Here, the muscle symptom can be in the form of muscle wasting or atrophy. Also, other muscle symptoms are the muscular spasms and also involuntary movements of a muscle, namely muscle twitches or what we call the fasciculations, or as a minor form is the fibrillations in a muscle. Also the muscle pains. So the muscle weakness, the muscle atrophy or wasting, the muscle spasms, the muscular twitches, and muscle pains, these are all clinical symptoms related to diseases affecting the muscles as a clinical symptom. But the myopathy may be just a pathologic involvement of a muscle without clinical symptoms, and this we call it subclinical or asymptomatic myopathy. But the clinical symptoms which I just mentioned, the weakness, the atrophy, the fasciculations or twitches, the spasms, the muscle pains. Of course, the muscle pains is the most common form of muscle symptoms in clinical practice, and this is rather a non-specific symptom in clinical practice, which may be associated with many diseases affecting the human body, including inflammatory diseases, autoimmune diseases, and infectious diseases, and even with neoplastic causes, that is, with cancer or malignancy, as a paraneoplastic feature of non-metastatic paraneoplastic feature of a cancer or malignancy. So these are the general causes of muscle pains, or what we call in clinical practice myalgia. So myalgia is the most common symptom related to primary or secondary diseases affecting the muscles, or related to acquired and genetic diseases affecting the muscles, causing myopathy or myositis. So this is the most common, is the myalgia. Just like the arthralgia and the bony aches, and so the muscle aches or the myalgias and the joint pains or the arthralgias and the bony aches, they are just musculoskeletal symptoms which are non-specific, and it can be a presentation of many diseases, whether inflammatory, as I mentioned, or infectious causes related to many infections, whether viral infections or bacterial infections. They can present with myalgia or with arthralgia, most commonly with the viral infections, and also related to autoimmune diseases, as with collagen vascular diseases, namely with systemic lupus erythematosus or rheumatoid arthritis, or connective tissue diseases, or connective tissue overlap syndromes, or mixed connective tissue diseases, or other autoimmune diseases. And also might be a presentation of a neoplastic pathology in the human body, namely cancer, as a paraneoplastic presentation or non-metastatic presentation of an underlying malignancy. So this is the muscle symptoms related to diseases. As I mentioned, whether the disease is arising in the muscles, we call it primary muscle disease, or they are secondary with primary involvement of other systems or organs by other systemic or localized diseases. Let me now shift to the most common causes of diseases presenting with muscle symptoms, that is with, as I mentioned, to recapitulate again, weakness or atrophy of the muscles, or pains or fasciculations or muscle spasms. These are generally can be included or discussed under two main groups: genetic or hereditary causes, and this involves the what we call the muscular dystrophies, like the Duchenne muscular dystrophies, like the Erb muscular dystrophy, like the myotonic muscular dystrophies, or the myotonic myopathies. This is called the hereditary myopathies. And this is one of the neurological diseases affecting the muscles. And then we have the, or affecting the neuromuscular unit, that is the nerves and the muscles. Like the chronic inflammatory demyelinating polyneuropathy, also the chronic inflammatory demyelinating polyneuropathy, or the CIDP, which may be also primary or secondary. So the muscular dystrophies, the hereditary muscular dystrophies, as exemplified by the Duchenne muscular dystrophy, the Erb muscular dystrophy, and the myotonic dystrophy associated with myotonia, or the phenomenon of myotonia. So this is hereditary. And then we come to another group, is what we call the motor neuron diseases, as exemplified by the amyotrophic lateral sclerosis, or the ALS, the amyotrophic lateral sclerosis. This is a motor neuron disease due to affection of the anterior horn cells, which give rise to the nerve supplying the skeletal or the voluntary muscles, or what we call the lower motor neuron disease. And the most common example is the amyotrophic lateral sclerosis. This is another example of also a myopathy presenting with, or diseases presenting with muscle symptoms, like muscle weakness and atrophy of the muscles. And also the other types of neurological diseases affecting the lower motor neuron, the nerves and the muscles. And then we come to another group of diseases, which is disease affecting the neuromuscular junction, namely the autoimmune pathology causing neuromuscular junction disturbances, namely the myasthenia gravis, due to the presence of antibodies against the anti-acetylcholine receptor antibodies, which plays a role in the hereditary myasthenia gravis as an autoimmune neurological disease due to the formation of antibodies against the neuromuscular receptors, or the neuromuscular junction, the anti-acetylcholine receptor antibodies. So this is a disease, or a neuromuscular disease, which causes the myasthenia gravis, which also present with muscle symptoms, as we all know. And then we have another group of diseases with muscle symptoms, which is what we call the inflammatory myopathies, or the myositis, and the autoimmune diseases causing the inflammatory myopathy. And the most common is what we call the dermatomyositis. The dermatomyositis. And the dermatomyositis is one of the collagen vascular diseases, as we all know, which involves the skin and the skeletal muscles. So the fibromyositis or the dermatomyositis as an autoimmune disease causing inflammatory myopathy or myositis. And here there is involvement of both the skin with the heliotrope rash, as we all know. There are classic dermatological features, and also there is classic symptoms of muscular involvement by the autoimmune process, presenting with proximal muscle weakness and atrophy, etc. So this is also another important group of diseases presenting with myositis and muscle symptoms, the dermatomyositis. Also, the muscle symptoms may be part of another important or other important collagen vascular diseases, may be also part of the systemic lupus erythematosus, SLE, or also may be part of the rheumatoid arthritis, or of the two conditions together, what we call the Rubus syndrome, or maybe also as a clinical symptoms of what we call the mixed connective tissue disease or the connective tissue. So the myositis, this is what we call inflammatory myositis or inflammatory myopathy or myositis. As I mentioned, and this is related to autoimmune diseases also, and collagen vascular disease. Then we come to another important group of diseases which might present with muscle symptoms are the metabolic and endocrine diseases. The metabolic and the endocrine diseases. Some forms of diabetes, especially in advanced stage, this is a metabolic disease, of course, as we all know, type 2 diabetes especially, and also it can happen in type 1 diabetes, might present with diabetic myopathy or diabetic neuromyopathy, and there may be muscle symptoms, namely in the form of muscle wasting and muscle weakness and atrophy, as one of the forms of diabetic neuromyopathies, as a complication of uncontrolled diabetic syndrome in type 2 diabetes, and it might happen also in type 1 diabetes as well, as a complication, as I mentioned. And this is due to microvascular complication of diabetes, the neuropathy or the neuromyopathy of such cases, and may take different forms, as we all know, whether in the form of proximal myopathy or distal polyneuropathy or sensory motor polyneuropathy. There are many types of neuromyopathic features in the diabetic syndrome, as we all know. So this is a metabolic disease causing myopathy also and muscle symptoms, the diabetes. Also, it's very common in thyroid disease, both hypothyroidism, that is underactive thyroid, and also in hyperthyroidism or the overactive thyroid, that's thyrotoxicosis. It might present also with myopathy. In uncontrolled hypothyroidism or non-treated or uncontrolled hyperthyroidism also. So thyroid disorders can be associated with myopathies. Also, inclusion body myositis is another form of metabolic myopathies as a part of metabolic syndromes, and it can be also affected the muscles in other metabolic diseases like in mucopolysaccharidosis and glycogen storage diseases, and many other rare metabolic diseases which can involve the muscular tissue and the musculoskeletal tissue in general. And then we come to another group of diseases, acquired diseases causing myopathies, and this is the malignancy or cancer. Cancer can present with muscle symptoms and myopathy as a part of, as I mentioned, part of the paraneoplastic presentation or non-metastatic manifestations of malignancy or cancer in the body, in the human body. So myopathy can be a presentation of, and here it is a secondary myopathy, as a complication or as a manifestation or as a presentation, paraneoplastic, non-metastatic paraneoplastic manifestation of cancer due to elaboration and production of certain active metabolites which play a role in the etiopathogenesis of neurological complications in patients with cancer. Among them is the involvement of the neuromuscular tissue as a part of the neurologic manifestations or a paraneoplastic neurologic presentation of cancer. Whether it is solid cancer, as we own in cancer lung, in cancer kidney, in cancer colon, in cancer liver, in cancer brain, even in hematological malignancies, presenting with neurological and in general and with neuromuscular complications in particular. So this is another important group of these which can cause acquired causes, which is the neoplastic causes of myopathies, cancer. And then we come to the next group of acquired causes of myopathies or of myositis, and these are drug-related or drug-induced. And the most common drugs causing, of course, muscle problems and clinical symptoms to muscles are corticosteroids and immunosuppressive agents, and maybe also the vaccines. Some vaccines can trigger neuromuscular complications as a late post-vaccine manifestations or rare side effects of vaccine administration, different types of vaccines. So vaccines, steroids, immunomodulating drugs and agents, cancer drugs, or the cytotoxic drugs which we use in chemotherapy. These drugs, especially some groups of anti-cancer medications or anti-cancer chemotherapy, they can also cause muscle problems or symptoms related to muscles. So these are the drugs most commonly associated with myopathies, or what we call drug-induced myopathies: steroids, anti-cancer chemotherapy, immunomodulating drugs, vaccines, etc. And also statins. Remember this, because statins are commonly used to treat lipid disorders, especially in diabetes and in association with other disorders associated with hyperlipidemias, especially the hypercholesterolemias. We use statins. Statins are associated with, remember this, with myopathic features or myopathic side effects, as well as with hepatopathic, that is, side effects on the liver. So we should follow the liver enzymes, we should follow the muscle enzymes in patients taking statins. So statins is a commonly used group of medications which can also cause side effects related to muscles or myopathies. So this is drug induced. And then we come to other rare causes, like as I mentioned, the inclusion body myopathies and as acquired causes also. And also in relation to parasitic diseases, some parasitic infections can cause muscle problems, and inclusion body myopathies, and these are what we call the acquired drug-related or drug-induced myopathies. So this is in general the hereditary or genetic and acquired diseases associated with myopathies or myositis, and can present with muscle symptoms in clinical practice. And it will be confirmed by myography and neuromyography and measurement of the muscle enzymes and etc., or to confirm the involvement of muscles in the clinical disease. Thank you so much, Professor Dr.